Hello, this is Carl Bruns-Kyler with Big 6-5 Senior Insurance Services, and I hope you're enjoying my special report, How to Avoid the Biggest Medicare Mistakes. As a certified senior advisor, I'm constantly receiving questions from clients and consumers. The irony is that in the 15 years that I've been doing this, every year it seems to get more complicated. Here's a question I received from Susan in Augusta, Georgia, and it reads, Carl, my husband will be turning 65 soon. He's in perfect health and he doesn't take any medications. Now he's asking me why he even needs to bother with a drug plan. What should I tell him? Well, Susan, there are two good reasons for enrolling in a Part D prescription drug plan. The first is to avoid paying a penalty to Medicare. It comes out to about 1% of the average cost of a plan, or around 30 to 35 cents for each month that you do not enroll in the plan. If your husband avoids rolling for a year, it could cost him up to $1,300 to $1,500 over the course of his lifetime. The second reason to enroll is the reason we have insurance in the first place, and that's to avoid catastrophic risk. Your husband's not taking any medications now, but I've discovered over the years that if you live long enough, you get old. And if you do get old, eventually you get sick. There are so many expensive prescription drug medications that can be prescribed. Here's an example. I have a client who was diagnosed with lymphoma, and they received folletin injections. Those injections, when purchased at CVS, were over $7,000 per injection, and this person was going to need them for quite a while. Not having a prescription drug plan could mean tens of thousands of dollars out of pocket. Having a Part D plan would cap that exposure to catastrophic cost at only a few $1,000s. This is just one of the many questions I'm able to help you with. If you do have concerns about your coverage, then I encourage you to click on the link below and enroll in a no-obligation Medicare coverage strategy session. They typically last 15 minutes and we can review your questions. Again, I'm so confident you'll find value in this that if you don't, let me know and I'll send you a free box of Gajiba chocolates. Again, this is Carl Bruns-Kyler with the Big 6-5 Senior Services, and my goal is to help you take the mystery out of Medicare.